Tonight, a vigil for two Kansas correctional officers who both died from COVID-19. They worked at the Lansing prison where more than 900 cases broke out. KMBC 9's Brian Johnson joins us live from Lansing tonight.
Yeah, Laura, both of these events, the vigil and the visitation, filled the parking lot behind me. The two men together gave more than 55 years of public service. And take a look at this video. For 2 hours, the cars slowly drove by quietly for the visitation, past the families of the officers. Flags filled the area with a massive American flag held up by 2 fire trucks. Now, Corrections Supervisor George Bernard Robert died May 11th. He was 61 years old and had survived leukemia. He was a Marine first and then spent 36 years working in corrections. His colleague, Corrections Supervisor Fela Adabi, died May 12th. He was in his 50s and he had worked at the corrections for more than 20 years. Now, corrections takes a lot of skill and patience. Obviously, the goal is keeping people safe and returning those individuals better when they go back. And both men were excellent at both their jobs.
They were more than supervisors here at the Lansing facility. They really served as mentors for many of our staff here, and they're going to be greatly missed.
These men were dedicated to a very difficult career, but very thought very highly of from all of their coworkers, and will be truly very deeply missed.
While the visitation was public, the candlelight vigil was for the families and corrections staff only. The department says these deaths were in the line of duty, and as such, their names will go on a memorial nearby. The department really did everything they can to recognize these men and the sacrifice that they and their families gave. Live in Lansing, Brian Johnson, KMBC 9 News.
At the Lansing Correctional Facility, half of the staff members who contracted COVID-19 have recovered. 90% of inmates have also recovered. Kansas legislators are trying to restrict Governor Laura Kelly's emergency powers. They're still at it tonight in a usual marathon session. Michael Mahoney is there too. Michael?
Yeah, we are here as this legislative session continues towards the midnight hour, a marathon one-day session to deal with coronavirus issues. The House and Senate Judiciary Committees have been meeting and seem to be very close to a conference report agreement that would mean they would go ahead with the bill to restrict some of the powers of Governor Laura Kelly during this emergency. The Republicans here say that in many instances she has gone too far. She closed the schools, closed businesses, and damaged the Kansas economy. Some think she's created new laws that are not really on the books. Attorney General Derek Schmidt's new opinion doubts that some of the second wave of orders are legal.
Clearly, she's acted beyond the authority that she's had.
One Senate plan includes restricting her from new virus emergency orders unless top lawmakers approve. Democrat John Carmichael thinks the intent here is to get the governor and the Democrats.
This is nothing more than just bushwhacking, folks.
But the House Judiciary Chairman says that's not true.
Continue to have some legislative oversight and make sure that we're able to manage what happens across the state, over the weeks and months to come.
Motion carries.
This is a rush because it's the last day lawmakers can legally meet. Most of the bills deal with an element of the virus. One blockbuster, Kansas Medicaid expansion, which once looked like a sure thing, has been defeated.
Black and brown people are the most affected because they are poor, plus they have all the underlying medical conditions.
So it is a marathon last chance session here at the Kansas legislature where lawmakers have defeated a bill that would promote Medicaid expansion, and they are also now still working at this late hour on a bill that would restrict the governor's emergency powers authority. Michael Mahoney, KMBC 9 News, Topeka.
Some, but not all, were wearing masks at the Kansas Capitol today, but everybody was required to have their temperature checked as they entered the building. Missouri lawmakers want the governor to call a special session so they can help protect businesses from coronavirus-related lawsuits. The Missouri Chamber of Commerce calls coronavirus liability an emerging problem. The chamber says under current state law, coronavirus lawsuits can move forward regardless of whether businesses were taking safety precautions. Tonight, Kansas City, Missouri restaurant owners got the green light to turn their parking lots into dining areas. The city council unanimously passed ordinances to help restaurants reopen after the lifting of stay-at-home orders. Parking lots can now be used for more table space and social distancing. Restaurants will also be allowed to sell alcoholic drinks through delivery and takeout services. These ordinances will stay in place through the end of the year. New tonight, Ride KC plans to add hours to some of its routes now that ridership is increasing. Those schedules were reduced after stay-at-home orders were issued. Starting May 31st, routes normally scheduled to run past 9 p.m. will return to that late schedule. Tomorrow, the governor's modified Phase 2 reopening plan takes effect in Kansas, and our Chris Ketz is here after talking to a local infectious disease expert on how to protect yourself and how long before we can get closer to normal. Hi, Chris.
Laura, good evening to you. Of course, a big part of the governor's modified Phase 2 reopening plan tomorrow is that state-run casinos can reopen under state-approved guidelines. But that's not all we asked about today. Dr. David McKenzie is an infectious disease specialist with Research Medical Center and HCA Midwest Health.
Are my chances of getting COVID-19 better, worse, or the same than they were 9 weeks ago?
I do get that question a lot. There's still a significant chance of acquiring COVID-19, although the numbers of cases have been declining. So the relative risk is probably lower than it was 6 or 8 weeks ago.
Originally, Phase 2 in Kansas allowed for gatherings of up to 30 people, but tomorrow, modified Phase 2 will limit that to 15 people. State-run casinos can reopen, but only under state guidelines.
How can we protect ourselves in a casino?
It'll be challenging. The main way to protect yourself is to keep your distance from other people and to frequently wash your hands and to wear a mask at all times.
Under this modified Phase 2 reopening, bars, nightclubs, and pools remain closed in Kansas. Dr. McKenzie says he won't feel safe until there are no new cases of the virus.
Any guess when that might happen?
It's hard to know for sure. I think the earliest we might see a reduction to 0 cases would be sometime in July, possibly in August. But then there's a significant chance of a second wave occurring in the fall.
And finally, he still thinks we're a year out from a fully tested and reliable vaccine for COVID-19 because it'll take that long to test the thousands of people necessary to ensure it's safe and the time it'll take to make the millions of doses needed to protect everyone. Dr. McKenzie says it is critical when it comes to being inside a casino, social distancing, and as important as that is, wearing a mask, he says, is even more important. Don't be surprised if you see slot machines or maybe tables, or maybe seats, that is, at blackjack tables blocked to ensure 6 feet separation. Of course, buffet lines are going to be closed certainly for the near future. And Laura, some casinos may even check your temperature at the door, make sure that you have a mask to wear on the floor at all times. These are some of the things that we're seeing in other states, casinos, that is, as those states lift their stay-at-home orders moving forward.
All right, thank you, Chris. The United States government has ordered 300 million doses of an experimental 300 million doses of an experimental COVID-19 vaccine, which is being developed in England. Those doses will be delivered to the U.S. in October, but they will be placed in storage until the vaccine completes its clinical trials, ensuring that it is safe and effective. The U.S. will pay as much as $1.2 billion for that vaccine. Tonight, the CDC says the coronavirus does not spread easily on surfaces. There is a possibility the virus can be transmitted by touching a surface than touching your face, but you are more likely to catch coronavirus through person-to-person contact.